guys, welcome back to Medical Coding with Blue. Today's episode is all about if you have let your RHIT, Registered Health Information Technician, certification lapse, should you try to get it back? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a really good email about this and I'm going to read the email and we're going to get into it. So here we go. So the email says, "Hi Blue, I just want to start with, I love your enthusiasm and your videos. You make me smile and feel wonderful about the medical coding field. I have always loved paperwork, numbers, and the medical field. When I was in my mid-20s, I was working in a hospital on the unit as a unit secretary. I enjoyed what I was doing, but still thinking about furthering my career with a degree. I did go to the local community college and obtained my Associate of Applied Science in Health Information and obtained my RHIT. I took the RHIT exam and passed, but never went into the field. I was working in a medical records department, release of information, as a data analyst. I wanted to go into coding, and I did take the test my employer gave, but I failed it. It made me feel so embarrassed and humiliated, so I stayed working at the same position and was going to study more and retake the test, but then life happens. I have all the excuses, but I never utilized my credentials, and now I am 52 years old and I am still working in the medical field as a scheduler. But I really want to go into medical billing and coding. I say medical billing too. I am fascinated by insurance aspect of the field. My question for you is, if I want to go into medical coding, should I retake the RHIT exam and get my credential back? I'm not even sure if I can at this point. I am older now and very determined to succeed. Let me know what your thoughts are. Have a nice day." All right, so a few things to unpack here. First of all, we have to understand what the RHIT is. That is the credential that you can sit for after you have completed a CAHIM approved Associate of Applied Science program, right? So that you can sit for this certification. You cannot just walk in there willy-nilly and try to get this. You have to have gone through a CAHIM approved program. Now, when you sit for this, the RHIT, they are typically what they do is they are auditors, they are lead medical coders, they can be chief of a whole department. It really all depends on the facility. Some facilities you have to have an RHIA, others you can have an RHIT and be just fine with that. But the thing is, it's really meant for leadership. Those are the ones who are really kind of in the supervisory roles and things like that because they have their degree. The RHIT and the RHIA are technically not meant to be full-time medical coders. They have to have some sort of leadership thing, going on in their role, because that is what they are trained for. Now, before you say, "Oh no, Blue, my hospital only," oh no, we're not going to play this. There are people on these listings that say that they want an RHIA, RHIT, or CCS, CCSP, whatever. So they'll do that because who doesn't want to have a degree holder? However, in this field of health information, when it comes to degrees versus credentials, the credentials hold just as much weight as the degrees. It really all depends on what you're doing. And for some positions, right, the medical coding certifications, the CCS, the CPC-A, the CCSP, or the CPC outrank the degree designations when it comes to coding, because these four are the ones that are really trained particularly in medical coding. When you look at the syllabus for the RHIA programs or the RHIT programs, you'll notice that the coding is a very small portion of those programs. The majority of those programs are covering other things like leadership and the laws and ethics and all of those types of things, statistics and all of that. That's what that is covering. It's not really doing a deep dive into the coding because that's what there are coders for. Now, in this situation, depending on how long you went through that program, things have changed. I mean, if you went through that program before 2015, you were looking at ICD 9 times. And certainly you're going to have to work on learning coding. And so that way, if you want to sit for it again, my suggestion is this: don't sit for it again, because that ship is already sailed, unless you want to be in leadership, which it doesn't sound like they do. It sounds like they want to be a coder. In that case, try to study for and sit for the CCS, the CCA, the CCSP, or if you want to go with AAPC, the CPC. One of these four, and you'll be good to go. Now, before you say, well, wouldn't it be better if I just did the RHIT again? Again, you want to set yourself up for success. Yes, they will take you with the RHIT, but again, your knowledge base is all about ethics and like human resources and type stuff like that. It's not on the coding side. So if you want to get more into coding, I would recommend the CCS, the CCA, or the CCSP, or the CPC. One of those, because that's where it sounds like the viewer wants to go. The other thing I want to talk about is the fact that they took the test with the employer and they failed it. And because of this one failure, they just gave it up and went back to scheduling. So all of this education that you've been through, all of the experience that you've had with release of information and all these other things, and all the training you got when you went through your associate's program, and you're a scheduler now. With a scheduler, that's not technical. You don't need technical training for that, right? Because you're answering the phone or you're calling the patients. And while this is a very important function, this is not meant for somebody who has taken the time to invest in their education and that kind of thing. This is why I always tell brand new medical coders, don't apply for scheduler positions, because that position does not require technical training like the coding does, right? Now with billing, you don't have to be technically trained either, because if you look at the job listings for billers, they're just asking you to have, sometimes it's like you have to have experience, and sometimes it is that you just have to have a high school diploma or a GED, because a lot of times billing companies will train you. The process of billing is really, you're just processing paperwork. You're not doing like the coding part, because hopefully you have a coder on staff who is doing that, and then the coder just sends over the information so that the billers can put it into the forms and submit it onto insurance. And that's how that process goes. Medical coders and medical billers are not the same thing. We are cousins, but we are not the same thing. Now, billers have a very important role in the fact that the money comes in via them. So they are the ones that have to work with the insurance companies. They're the ones who have to work with the patients and collect the money and input all of that and do all of the accounting type stuff. So you do have to be good with numbers. You do have to be decent with plus, minus, multiplication, division, math. But with the medical coding side, now you really have to look at everything that the doctor wrote. You have to understand, you have to be able to comprehend, you have to be able to problem solve when you can't figure out which diagnosis to select or which procedure to select. You have to be able to look this stuff up and know where to find it. The fact that they failed a test, it doesn't surprise me, because again, for the RHIT program, they're not heavy in coding, right? And neither is the RHIA program. It's not heavy in coding. It's just a very small blip, okay? Because you have to know just a little bit. So this is why I say, don't go after those degrees thinking that if you have a degree, it's going to make you more money. And that's where people are getting hung up, because that's the truth for other professions, not for medical coding. Medical coders can do quite well with just a certification. Just one. You don't have to have a slew of them. You don't have to have, all of these things. It's just one. You just need one certification and time. I have outmade RHIAs, RHITs, and nurses being a medical coder. So if that should tell you something, and at that time, all I had was a CCA, the Certified Coding Associate. And yes, that is the entry-level certification. But it comes down to this. It comes down to being good at what you do and being thorough and being detail-oriented. That's what it comes down to. And of course, having good employers who understand, because not all employers understand. They think, oh, CCAs can't do anything. which really pisses me off because that shows ignorance on their part. It's not about the credential that the person holds. It's about the ability of the individual. Because somebody, even with a CCS, can be like, I'm lost, I don't know what to do. And a CCA cannot run them. I know because I did it when I was a CCA. Now I have my CCSP, the Certified Coding Specialist Physician-Based, and the CCS, the Certified Coding Specialist. That is the gold standard of medical coding credentials. Because it is the one credential that says that you have mastered both inpatient coding and outpatient coding. I'm just saying. So that's something that you really have to consider. So what my advice to this individual would be is to get into a good program. And the programs that I have recommended before are directly with the associations themselves, because I cannot speak favorably for any of these trade schools. I have not been to any of these trade schools, and a lot of people try to message me and tell me, well, just tell me if this program is good or that program is good. I don't know. I haven't been to those programs. I went to a trade school that is now shut down. It has been shut down since years ago. And so it really takes you as the individual that is going through this to look for a program that is going to teach you everything that you need to know. And you will have to learn by yourself. That is almost guaranteed. Because while there are some places that say, oh yes, we have people that you can email and write and ask questions and things like that, how many people have written me with the same song of, they promised this to me and I don't have anybody to ask questions to, and it takes weeks for them to answer my question and things like that. So in order to be prepared, you guys have to know that you have to train yourself. Now, I do have the independent study video, and I will leave that link in the description box below. If you ask me, I will point you to the description box below. And so it has all of the list of all of the books that you need, because you don't even have to go through a program in order to sit for one of these certifications, right? The CCS, CCA, CCSP, or the CPC. It does not require you to go through a formal program. All you need is a high school diploma or a GED. Yeah. And before you tell me, well, no, Blue, it says it's recommended. And oh yeah, it is recommended. It is definitely recommended, because when you try to sit for something like the CCS, again, that is the gold standard. That test is a rough test. It is no cakewalk. I had 8 minutes left on the clock when I took that test. And oh yeah, I was exhausted when I got out of there. And only because that is a very hard test. Now, I've been a medical coder at that time for 13 years. And I studied and I worked hard, and I passed it with a few touchdowns. And that felt pretty good. But I'll tell you what, that test put up a fight. And it's going to fight you as well. Any of these tests. So you have to be prepared. Like I said, you can go through the American Health Information Management Association online. They have their online 13-course bundle. The thing with that is it'll take you about a year to get through, right? Which I always say 9 months, 12 months, or 18 months. That's what you're looking at lengthwise when you're looking for programs. Please don't get into these programs that are a month, 2 months. Ugh, I hate that one. It's like 2 months. They say, oh yeah, it's 2 months. 2 months to learn medical coding, really? You're setting people up to fail. And I don't care if you have a medical background. It doesn't matter. Medical coding and anything else you've ever done is completely different. And when you get into the program, trust me, you'll understand. 4 months is also ridiculous. 6 months is ridiculous as well. 8 months, again, it's not 9 months, but you don't have to take the test right at 8 months either. You can take additional time to study. Now, here's the thing. With this independent study thing, right? You can get the books, you can study on your own, make your own schedule, study for 9 months or 12 months or 18 months, then prepare yourself for the test. And then at least within 30 days or 90 days of completing everything, right? And then you can go in and take your test. And it's any one of these 4. You just need one. You don't need both. You don't need 3. You don't need 4. You only need one. And pick whichever one you want to go through. AAPC has their online medical coding program as well. Their site is a little easier to navigate. And all the HEMA you do have to pay for the book separately. So that's just something that you have to be aware of when you are sitting for these programs, all right? The rough estimate cost of either association is about $5,000, give or take, okay? And that's including the fees and everything else. That is not including the cost of the test or any of those things. This is just the program itself, all right? So that's something that you need to be aware of. Yes, it is a little costly, but if you study on your own, you can save some money. And again, I do have the syllabus, and I post it for free, so that way you all have access to it. You can get the latest books. If I haven't updated the links, at least you know. They have, I still need to go back and update because they have the new 2023 guidelines out. And the last time I updated it, it was 2022. But you can look for the 2023 ICD-10 CM official coding guidelines. And you can find them for free for download at cms.gov. You can even Google the ICD-10 CM coding guidelines for 2023, and that PDF will pop right up. So that's just a resource that you can use. It's very important for you to understand those rules. That's what I would say on that one. Now, giving up so easily because you failed one time, that's a no-go. Because if you have not made peace with that, if you are going to continue to do that, you're going to be wasting your time. And I'm talking to anybody who has this experience. If you get discouraged by one failure and you do not keep going, you are always going to run from everything that you do. You have to be strong. This field, health information management, medical coding, medical billing, it is not for those who are weak as far as like they just can't take failure, they can't take rejection, because there's a lot of failure and there's a lot of rejection in this. But you will be stronger on the other side if you can push through it, if you can manage to stay focused on what you're doing, if you can manage to ignore what other people around you say, because there's going to be a lot of naysayers out there. There's going to be a lot of naysayers that are going to try to like keep you down and tell you, oh no, this isn't good for you. It's your life. Your life, your career, your investment of your time. And time, guys, is money. Time is money. And people have spent years, sometimes decades, thinking that they should have done medical coding a long time ago. But, you know, they had some other excuse and something comes up and they had this and they had that. People are afraid sometimes of success and hard work. But if you are not afraid of success and if you are not afraid of hard work, then this is a field that could potentially be for you. But you have to want it. This is not something that's going to be given to you because this is not an easy field. It is not an easy field to understand. It is not an easy field to get into. And it's hard in the beginning to stay in it if you are not studying, because you will be tested. You will be tested, you will be audited. If you are coding incorrectly, you need to do everything that you can to course correct yourself. Make sure that you're still studying those books, so that way you do not lose your opportunity to continue to do this and work in this field. Because that's what it takes, guys. It takes study, it takes hard work, it takes professional and personal development. That's what it takes. And again, you cannot just sit there and just give up and feel embarrassed, because now you're letting your ego get in the way. And I've seen ego damage a lot of lives because people just can't get out of their own way. This person, I mean, obviously they felt disappointed that they didn't pass it, but they also stayed where they were, and they're working in a position that is requiring no technical training, when they have this education and they're just letting it go past. So again, if you want to study for it again, sit for it again, talk to AHIMA, because I don't know how long it's been since you took your program or what the requirements are. I've heard of some people doing that they were just able to take it again. It really all depends. So you'll have to reach out to AHIMA. But again, if you want to be in a leadership position, then go with the RHIT. If you are wanting to just get into the medical coding part, then go for the CCS, the CCA, the CCSP, or the CPC. Any one of these credentials will get you going and get you into the field. But again, it has to take you to be diligent, and it has to take you to really get with it this time. And you can't just let the first knockdown take you out, because it's going to keep punching until you start fighting back. I'm just saying. So if this video helped you, I hope that you will like and subscribe, share if you haven't already, and I will see y'all next time. Bye.